Hi there, welcome to FamilyDoctor.expert. My name is Grant Blaschke. Today we're talking about vertigo. So they say you've got 5 senses, but for anyone who's experienced loss of balance, you'll be convinced that that's a very important sense too. It's one of the most distressing symptoms you can have. Often people have the world spinning or themselves, a sense of spinning, loss of balance, often a lot of nausea, sometimes vomiting, sometimes other symptoms as well too. 3 common causes that your doctor will be concerned about. Firstly, a thing called BPPV, which is benign paroxysmal positional vertigo. Now this is due to some tiny little stones, little calcium stones we call canaliths, that sit in the inner ear. And you may not realise, but your inner ear's got a little spirit level in it, like a fluid level, and little stones can collect in there and really upset your balance. Second cause that your doctors may think about is a thing called labyrinthitis or vestibular neuronitis. It's really an inflammation of the nerve in the inner ear, often from a viral infection, and this can also come on quite suddenly. Now another cause is Menieres disease, which is fluid buildup in these little fluid canals in your ear. Now these can also result in ringing in the ears and sometimes hearing loss as well. So they're the 3 common causes. There are other things. Sometimes people get migraines with or without headaches, sometimes with visual symptoms, with what we call vestibular migraines, and they can really mimic a lot of those other problems. Of course, a loss of balance, your doctor wants to exclude that there's a serious brain issue of any sort, like a stroke or a brain tumour. Some red flags would be, for example, if you had slurring of speech or some, weakness or changes in sensations on one side of the body. They would really ring alarm bells for your doctor, and they want you to get checked straight away to make sure you're not having a stroke. Down the bottom of the list, sometimes people have their first symptoms of multiple sclerosis with vertigo, but this is more rare. So there's the big list that your doctor will try and work through. So usually if you come along, you tell your doctor that you've got a sense of spinning or like the world's pulling, sometimes tilting. Some people get their sensitivity to visual movement, like traffic or spinning fans can sort of make them feel very off balance. Sometimes people are quite nauseous. Sometimes people have what we call nystagmus, like a jerkiness of their eyes. Your doctor's going to have a good look at you, check out if there's any signs of these particular conditions. They'll do what we call a neurological examination, check your eyes. They might want to check the coordination of your hands. They may do a special test we call the hall pie, where they get you to turn your head and lie back on a bed to see if they get this jerky eye movement called nystagmus. And that tends to suggest the BPPV problem. Now, if they're worried about some of the other causes, they may want to do some more tests. They might want to arrange a special scan of the brain, like a CT scan or an MRI. Sometimes they might want to do a blood test, might want to do a hearing test. They might want to do some very special vestibular tests in some instances, where they can pour hot or cold water in your ear and have a look how your inner ear system is working. But that's usually something done more in a sort of specialist setting than something that your GP would do. So what do you do about it? Well, the good news with a lot of the vestibular problems is that the time is very helpful, because the brain has an incredible capacity to adapt. So eventually your brain will adjust to different signals coming from the inner ear. But in the acute setting, often nausea is a big problem, and there's a particular anti-nausea tablet called Stemetil, which is very good at helping inner ear problems. So that's something that your doctor might suggest. Now, depending on the cause, there's a whole lot of different pathways that you might go down. Now, if your doctor's really convinced that you've got this BPPV, the illness with the little stones in your inner ear, they might get you to do a special maneuver we call the Epley maneuver, where they lie you back quickly with your head tilted, and the aim of this is to try and displace the little stones in your ears. If it's vestibular neuronitis or labyrinthitis, there's a few things that help. Some patients get benefit from a medication called prednisolone, which turns down the inflammation, and that can be very helpful. If there's a migrainous pattern to the vertigo, the various migraine treatments can be very helpful. Now, if they think there's a stroke going on, obviously that's an urgent referral, very important to get to hospital. There's lots we can do in the early stages to stop the worst effects of stroke, so your doctor would urgently refer you. Menieres disease, the buildup of fluid, the pressure of fluid, there's a bunch of medications that can be very helpful for that, particularly one called Circ, which is a strong antihistamine tablet that can really help reduce some of that fluid in the inner ear. There's a whole discussion about what you can do for Menieres disease beyond the scope of this, but often we have ear, nose and throat specialists involved. While you're getting over it, look after yourself. It's pretty stressful. You may decide that it's not a good time to be driving, operating heavy machinery. At home, if your balance is off, make sure you've got good lighting to try and avoid falls. So you can see that there's lots of possible causes with vertigo, lots of good treatments. Some people go along to a physio, special sort of physio who does vestibular rehabilitation and helps people retrain their vestibular system. As usual, this video is just for general guidance. Don't make any decisions based on this video. Always speak to your doctor before making any medical decisions. But hopefully you'll be able to ask some really good questions after watching this. Wish you all the best from FamilyDoctor.expert.